Have you ever wondered why your skin feels different after starting a medication? Could your frequent infections be linked to the pill you're taking every morning? Or why you're suddenly experiencing symptoms of nutrient deficiencies despite eating a balanced diet? Pantoprazole, a widely used acid reflux medication, has some unusual side effects that most people don't know about. From unexpected changes in your skin to recurrent infections and hidden nutrient imbalances, these effects might seem random, but they're deeply connected to how this medication works in your body. Also, note that these side effects may not be experienced by everyone, and only a few individuals might experience them in long-term use. In this video, I'll reveal 8 strange side effects of pantoprazole, explain the science behind why they happen, and share actionable tips to help you minimize or even prevent these issues. Whether you're currently on pantoprazole or simply curious about its effects, this is information you can't afford to miss. So let's dive in. Now, what is pantoprazole? Pantoprazole is a widely used medication prescribed to manage conditions such as gastroesophageal reflux disease, GERD, and Zollinger-Ellison syndrome. It belongs to a class of drugs known as proton pump inhibitors (PPIs) that work by reducing the production of stomach acid. This reduction helps alleviate heartburn and prevents damage to the esophagus caused by excessive acid. Pantoprazole's effectiveness in controlling acid production makes it a popular choice for those suffering from acid-related conditions. Despite its therapeutic benefits, pantoprazole is not without its downsides. Individuals on this medication may experience a variety of side effects, some of which can be quite unexpected. Now let's dive into these weird side effects. Number 1. Digestive discomforts. Pantoprazole, despite its effectiveness in reducing stomach acid, can paradoxically contribute to various digestive issues. Some users often report experiencing nausea, difficile-associated diarrhea or diarrhea without infection, and abdominal pain as common side effects. These symptoms occur primarily because pantoprazole significantly lowers stomach acid levels, which are essential for breaking down food and absorbing nutrients efficiently. When stomach acid is reduced, digestion can become less effective, leading to gastrointestinal disturbances. The reduction in stomach acid can disrupt the digestive process in several ways. For one, lower acid levels can hinder the breakdown of proteins, fats, and carbohydrates, making it harder for the body to extract the necessary nutrients from food. This can result in incomplete digestion, causing symptoms like bloating, gas, and abdominal discomfort. Additionally, the imbalance in stomach acidity can affect the natural motility of the digestive tract, leading to issues such as constipation or diarrhea. Users who experience these digestive side effects should be proactive in discussing them with their pharmacist or doctor. They may suggest adjusting the dosage or switching to a different medication to alleviate these symptoms. In some cases, dietary modifications can also help manage these digestive discomforts. For instance, eating smaller, more frequent meals, avoiding foods that trigger symptoms, and incorporating probiotics to support gut health can make a significant difference. Number 2. Respiratory health concerns. Research indicates a link between pantoprazole and an increased risk of respiratory infections. This risk arises because the drug's acid-suppressing action alters the pH balance in the stomach, creating an environment where harmful bacteria can thrive. These bacteria can then migrate to the respiratory tract, leading to conditions such as pneumonia or bronchitis. The stomach's natural acidity serves as a barrier to many pathogens, neutralizing harmful microorganisms before they can cause harm. When pantoprazole lowers stomach acid, this protective barrier is compromised, making it easier for bacteria to survive and proliferate. Some of these bacteria can make their way to the lungs through aspiration or other mechanisms, thereby increasing the risk of respiratory infections. Individuals taking pantoprazole should be vigilant about respiratory symptoms, especially if they develop a persistent cough, difficulty breathing, or other signs of infection. It's essential to report these symptoms to your doctor or pharmacist promptly, as early intervention can prevent complications. In some cases, they may recommend additional measures, such as the use of probiotics, to help maintain a healthy balance of gut bacteria. Number 3. Vitamin and mineral deficiencies. Pantoprazole's effect on stomach acid can lead to deficiencies in several essential vitamins and minerals, posing long-term health risks. Stomach acid is crucial for the absorption of nutrients such as vitamin B12, magnesium, calcium, and iron. By suppressing acid production, pantoprazole impairs the body's ability to absorb these vital nutrients effectively. Vitamin B12 absorption, for example, relies on stomach acid to separate the vitamin from food proteins, allowing it to bind with intrinsic factors for absorption in the small intestine. When acid levels are low, this process is disrupted, leading to potential B12 deficiency. Symptoms of a deficiency can include fatigue, weakness, anemia, and neurological changes such as numbness and memory issues. Similarly, magnesium absorption can be compromised. Magnesium is vital for numerous bodily functions, including muscle and nerve function, blood glucose control, and bone health. Deficiency symptoms might include muscle cramps, fatigue, and abnormal heart rhythms. Chronic low magnesium levels can lead to more severe health problems like cardiovascular issues. Calcium absorption is also affected by reduced stomach acid. Calcium is essential for bone health, and inadequate absorption can contribute to weakened bones and increased fracture risk over time. This is particularly concerning for older adults or individuals already at risk for osteoporosis. For those on long-term pantoprazole therapy, it's important to monitor nutritional levels regularly. Number 4. Muscle cramping and spasms. Muscle cramping and spasms can be particularly troubling for those taking pantoprazole. These unexpected symptoms may be linked to the medication's effect on the body's electrolyte balance. Pantoprazole works by reducing stomach acid, which can inadvertently affect the absorption of crucial minerals like magnesium. Magnesium plays a vital role in muscle function, and a deficiency can lead to muscle cramps and spasms. When the stomach's acidity is lowered, it may not absorb minerals as effectively, leading to imbalances. This can result in muscle cramps, which might manifest as sudden, sharp pains or as ongoing muscle discomfort. For some individuals, the cramps can be severe enough to interfere with daily activities, making it challenging to carry out routine tasks. Additionally, the body relies on a delicate balance of electrolytes to maintain proper muscle function. Electrolytes such as potassium, calcium, and magnesium work together to regulate muscle contractions and nerve signals. When this balance is disrupted, it can cause the muscles to contract involuntarily, resulting in spasms. Dietary factors can also play a role in muscle cramping and spasms. For example, a diet low in magnesium-rich foods like leafy greens, nuts, and seeds may exacerbate the issue. It's essential for patients to consider their diet and possibly incorporate more magnesium-rich foods to counteract the potential absorption issues caused by pantoprazole. In some cases, your doctor might recommend magnesium supplements to help manage these side effects. However, it's crucial to consult with your doctor before starting any new supplement regimen, as excessive magnesium intake can have its own set of complications. Number 5. Vision alterations. Vision alterations while taking pantoprazole can extend beyond blurred vision. Some individuals might experience an increased sensitivity to light, known as photophobia. This can cause discomfort in bright environments or even under standard indoor lighting, leading to frequent squinting or headaches due to the heightened sensitivity. Other vision changes might include fluctuations in visual clarity, where the sharpness of vision varies, making it difficult to focus on close-up tasks like reading. These changes might be mild or occasional, but they can still interfere with daily activities. The mechanisms behind these vision alterations could involve the central nervous system or changes in blood flow to the eyes, although the exact causes are not entirely clear. These symptoms, while rare, can be concerning and warrant attention from both users and healthcare providers. Individuals should be mindful of these potential side effects and report any persistent or severe vision changes to their physicians. Monitoring these symptoms allows for timely adjustments to the treatment plan, whether that involves modifying the medication dosage or considering alternative therapies. Number 6. Alterations in hair growth patterns. Some individuals taking pantoprazole have noted changes in their hair growth patterns, including unexpected hair loss or new growth in unusual areas. Though rare, these side effects can be concerning and may impact one's self-esteem and overall well-being. The precise reasons behind these hair changes are not completely understood. However, One potential explanation is that pantoprazole might alter the absorption of essential nutrients needed for healthy hair growth. By reducing stomach acid, the medication could interfere with the body's ability to absorb vitamins and minerals, such as biotin, zinc, and iron, which are crucial for maintaining normal hair growth cycles. Additionally, pantoprazole might influence hormonal balances within the body. Hormones play a significant role in regulating hair growth, and any disturbance in hormonal levels can lead to noticeable changes in hair patterns. This could potentially result in increased shedding or unexpected hair growth in areas where it is typically minimal. Another theory suggests that changes in hair growth might be linked to pantoprazole's effect on the gut microbiome. The balance of gut bacteria can impact various bodily functions, including skin and hair health. An imbalance in gut bacteria might indirectly affect hair growth patterns, although this connection is still being researched and is not yet fully understood. Number 7. Effects on bone health. Pantoprazole's impact on bone health is a significant concern for individuals on long-term therapy. Research has suggested that extended use of pantoprazole is associated with a decrease in bone mineral density, which could elevate the risk of fractures. This effect appears to be more pronounced in the hip, wrist, and spine. One proposed mechanism is the medication's potential to interfere with the stomach's ability to absorb calcium. Calcium is an essential mineral for maintaining strong and healthy bones. When pantoprazole reduces stomach acidity, it may also decrease the solubility and, therefore, the absorption of calcium. Over time, this reduced absorption can lead to calcium deficiency, weakening the bones and making them more susceptible to breaks. This is particularly concerning for postmenopausal women, who are already at higher risk for osteoporosis, a condition characterized by fragile bones. Another factor contributing to bone health issues is pantoprazole's potential effect on vitamin D metabolism. Vitamin D is crucial for calcium absorption and bone health. By altering the digestive environment, pantoprazole may indirectly affect how well vitamin D is absorbed and utilized by the body. Lower levels of vitamin D can exacerbate calcium deficiency, further compromising bone strength. Lastly, skin reactions. Pantoprazole can cause some unexpected effects on the skin. Users may notice reactions such as rashes or itching, which can be quite uncomfortable. In more serious cases, conditions like Stevens-Johnson syndrome might occur, although these are rare. The skin issues arise because the immune system might see pantoprazole as a foreign invader. When this happens, the body responds by activating an inflammatory response, which can lead to various skin problems. Inflammation is the body's way of dealing with what it considers harmful substances. When taking pantoprazole, some people's immune systems might overreact, causing the skin to become red, itchy, or even develop blisters. This reaction is the body's attempt to fight off what it mistakenly believes to be a threat. It's also important to know that skin reactions might not show up immediately. They can develop after a few days or even weeks of starting the medication. For those who notice unusual skin changes, it's essential to monitor the symptoms closely. If the skin reactions are severe or continue to worsen, it may indicate a more serious underlying issue. In the case of a severe allergic reaction like Stevens-Johnson syndrome, the skin may start to peel, and large areas can become covered in painful blisters. This is a medical emergency that requires immediate attention. Although it's a rare side effect, being aware of the symptoms can be life-saving. Thanks for sticking with me till the end. If you found this video helpful, don't forget to give it a thumbs up, share it with someone who might need this information, and subscribe for more health insights. Stay safe and take care of your health. Your liver will thank you.